Welcome back. Many women going through menopause, no symptoms, can significantly impact their lives, which is why treatment options need to be more openly discussed, and that's what we're doing today. Family physician Dr. Antonia Sappong is here to break down what you should know about menopausal hormone therapy. Give it up for Dr. Tony. Thanks for joining us.
Thank you.
First things first, what I just called it was not hormone replacement therapy. I called it menopausal hormone therapy, and that's because it's undergone a bit of a rebrand, right?
Yeah, exactly. Hormone replacement therapy implies that we need to replace something, that there's a defective state that exists if our estrogen and progesterone declines after menopause.
Yeah.
This is, in fact, a normal and expected course for all women. So
Right.
it's undergone a rebrand just to really reflect reality.
What is it, and why in the past has it been so controversial?
Yeah, so menopausal hormonal therapy is the use of hormones to treat symptoms of the menopausal transition or, menopause itself. In terms of why it's controversial, that largely came out of a study called the Women's Health Initiative. This was the first major study, randomized control trial that we did that looked at the health benefits and risks of menopausal hormonal therapy. The initial results were quite startling. They found that there was an increased risk of breast cancer, heart attacks, strokes, and blood clots. And so the study was actually terminated early, and it led to like a plummet in how many women were actually being prescribed menopausal hormonal therapy. What we now know, so we've gone back and we've reanalyzed the data, and a couple of things have really stood out. One of which is the fact that the average age of women in that study was 63. And if you think about the fact that the average age of menopause is somewhere between 50 to 52, this means that the majority, or at least over half of the women who were in this study, were being given hormones after their bodies had not really had any normal levels of estrogen and progesterone for over a decade. And as it turns out, that's really important. What we now know is that for women who are under the age of 60 or who are within the 10 years from their last menstrual period, the benefits of menopausal hormonal therapy actually outweigh the risks.
So the age group of the folks that they were studying and the fact that they had not been on estrogen or had not had any estrogen for many years
stopped making it,
made it a different and made them more susceptible to these blood clots and heart issues and cancer and interesting. That was a big one because I remember growing up with an aunt and she said, you know what, I don't care what they're saying, I'm going on HRT. She's like, I'm not living my life like this, and she did it and she's had no complications. She had no complications since. So, and I remember thinking, ooh, what a risky thing to do. Meanwhile, we find out that the study is faulty.
Yeah, it's just we now know more.
We know more.
We know more now.
Any other myths you'd like to bust when it comes to menopause? Because I feel like there might be a few.
Yeah, for sure. I find it helpful to talk about the breast cancer risk because that's often one that women are really worried about.
Yeah.
The Women's Health Initiative found that there was a 26% increased risk of breast cancer. What this actually translates to in real numbers does not mean 26% of women are going to get breast cancer. If 10,000 women are on menopausal hormonal therapy, we see an additional 6 to 7 cases of breast cancer per year. Meaning that if you put that in a percentage, 99.94% of women on menopausal hormonal therapy are not going to have any problems with breast cancer. So it's a very small risk. We also know that that risk really only applies once you've been on menopausal hormonal therapy for 5 years or more. So less than that time frame, the risk is even less. So that's important to understand. And so I think it's just really important that we have these conversations with women so that they can assess the risk for themselves, right? Because, I'm not in the menopausal woman's body. I don't know how severe their symptoms are. And, it might be worth it for them to be able to treat some of their symptoms while still accepting this risk of breast cancer.
Right. And you said something important. We could assess that ourselves.
I really believe that with the information, women can make their own decisions for themselves.
Right. Instead of struggling through maybe symptoms that can be completely helped with little risk. So who would you say should be thinking about menopausal hormone therapy? Is that it?
It's a mouthful, yes.
Who should be thinking about it and who should just say forget it?
Yeah, so basically if you are within 10 years of your final menstrual period or less than age 60 and you have symptoms like vasomotor symptoms, so these are hot flashes or night sweats, can be helpful to treat that. If you'd like to prevent or reduce bone loss, so osteoporosis, menopausal hormonal therapy is known to help with that. And the last sort of indication is to treat the genitourinary symptoms of menopause. So this is vaginal dryness, irritation, sometimes urinary tract infections. So certainly if you have any of those symptoms and you'd like to consider MHT, you would be considered a candidate. People who would not be considered candidates are women who have had a personal history of breast cancer, heart attacks or strokes, because they would be at higher risk. And then also women, if they have high blood pressure or abnormal vaginal bleeding, those might have to be investigated and treated before starting menopausal hormonal therapy.
Should you even think about starting hormone therapy if your symptoms are manageable? Like, do you have to wait until symptoms are unmanageable and you just kind of have a crappy quality of life before you think about it?
No. There is no magical age or threshold where we say, now you can have menopausal hormonal therapy.
Yeah.
I find a lot of women, they don't talk about menopause even amongst themselves, and so like they're often struggling alone, and that's really hard. In silence. That's not great. So I would say, like, if you're at all considering it, if you're having symptoms, talk with your family doctor, because you can better decide whether or not it's appropriate for you.
I want to talk actually about some benefits and side effects. Are there benefits and side effects of doing hormone therapy?
Yeah, totally. Apart from like the benefits for hot flashes and night sweats and those sorts of things, we know there's other benefits that are less well known. So, for instance, it can really help with sleep. And this is often because night sweats and hot flashes.
They feel like night flashes.
Right, they might be night flashes.
Yeah.
Often disrupt sleep. Menopausal hormonal therapy is also really helpful for treating the mild and moderate symptoms of depression, which we find are very common during the menopausal transition. It actually reduces women's risk of things like colon cancer and diabetes, which, again, super important to know. And then a lot of other benefits include things like the skin texture improving with use of menopausal hormonal therapy.
That's nice.
I know, right? And reduction in the appearance of wrinkles and fine lines. So
really?
And that's just a small flattering. So,
and I mean, it depends on who you are.
Absolutely.
We haven't talked about weight. I mean, asking for a friend about visceral belly fat, we know that this happens with a lack of estrogen, right?
Yes.
So, can the hormone therapy help this situation?
So what we know about menopausal hormonal therapy is that it does not cause additional weight gain.
Okay.
Unfortunately, going through menopause and getting older just means that naturally our muscle mass decreases and our fat unfortunately increases with time.
Yeah.
And so we often put on weight during the menopausal transition. It is not well known whether the menopausal hormonal therapy reduces that. Most likely, unfortunately not. The doses are actually quite low.
Come on,
so
doc.
it's unlikely to
do some research for me and come up with another answer.
I'll get right on that.
It's good to know. Listen, there are tons of benefits, and if it's making you feel like you're living life more to your fullest with a low-ish risk,
That's it.
You know, why not? Okay, such important information. Thank you, Dr.